Good evening, everybody, and welcome. My name is John Stamper of Medcast Productions, and welcome to Kettering Chats. Very, very excited to be coming to you live this evening on Facebook, so thanks for tuning in. We have a very special guest and a lot of great information, so very, very excited to let you know how this is going to work. We're going to be on here for just about 30 minutes, so we're going to have this, be full of great information from Dr. Hahn, our guest. We also want to have it be engaging, right? So like it always is on Facebook, we would love to have you put any questions for Dr. Hahn right in the chat, and we're going to have a discussion back and forth, but we'll be monitoring those questions and we'll be getting to those. So, all right, today's topic is heart health, something very, very important. And I want to take just a quick minute here to introduce our guest and the doctor this evening. So Dr. Harvey Hahn is a cardiologist specialist from Kettering Health and has been practicing at Kettering Health for 14 years. Now, after graduating from Loma Linda University School of Medicine, Dr. Hahn served as an assistant professor of medicine and cardiology at the University of Cincinnati, and a true honor for him to be in this part of the Midwest, as maybe he was going to go back to California, and we're fortunate that he stayed. So he is here. He is a board certified in internal medicine since 1997, cardiology and cardiovascular disease since 2010, a very accomplished physician. Dr. Hahn, it's a pleasure to have you on this evening.
And thanks a lot, John. Thanks for having me.
Yeah, absolutely. All right, so we're going to get into talking about heart health, and I would like to start it with what would seem like a general question, but one I'm sure you'll be able to enlighten everybody on in more detail. And that is, let's start with what is heart disease?
Yeah, that's actually a really good question. Most people think of heart disease as just a blocked up artery in your heart, but we look at it as cardiovascular disease. Every single blood vessel going to your heart muscle, to your brain, in your carotid arteries, and down to your legs can get blocked up by diabetes, high cholesterol, smoking, or high blood pressure. And blockages or damage to those blood vessels, that's what leads to heart attack, stroke, what we call claudication or limb pain when you walk, and also that can lead to sores, amputations, etc. So really the health of your vessels is probably the most important absolute thing that we treat as cardiologists or even vascular surgeons.
Yeah, and this also seems like somewhat, of a general, I guess, question around this, but why would somebody want to avoid heart disease?
Yeah, I think there's a couple ways to look at this, but probably the biggest one is the number one killer in the Western world is heart disease, cardiovascular disease. Number two is stroke. Number two is all-cause cancer. Number three is stroke. And most of the causes of death from stroke are what we just talked about. It's damage or disease or blockage of your blood vessels. And it's not just the mortality, it's also the limitations that you will have in your life. If you have blocked up arteries in your heart, you get what we call chest pain or angina, and then you can't do the things you want to do because you're limited by chest pain. If you have some heart attacks, your heart muscle gets weaker, doesn't pump well, fluid backs up into your lungs, and then you get short of breath, and we call that heart failure. Similarly, if you have blockages in your legs, you can only walk 20, 50 feet, and you have to stop because your leg muscles are killing you. But one of the worst things that doesn't kill you is probably getting a stroke where half your body's paralyzed, you can't talk, or what we call vascular dementia, where having little events happen in your brain from small blocked up arteries, and you actually have early onset dementia, which is a horrible thing to have.
Yeah, and it's interesting. Before we went live here, I had the opportunity to learn a little bit about your story, and it made me think about in any of the years that I've gone to my doctor and them sharing a lot of these tips that you just shared, as well as some things you're going to share, always adds a little bit more value to the situation when somebody like yourself can share your story and the importance of heart disease on your life and some of the things that you had to do. So we'd love to have you talk about that a little bit and share with everybody, what this means to you and some of the things that you had to do.
Yeah, so I went into cardiology because I like high technology, I like imaging disease. But as I kind of got into my job, graduated, started working, I put on about 45 pounds of weight, and I was actually had high cholesterol and high blood pressure and was on medication to be treated for that. Then I actually hurt my knee, my left knee, and I had trouble actually even getting out of my car. And I realized the reason that I was at this point was because I was eating whatever I wanted to, I was not exercising, working really hard, and putting on this weight. So I made a bunch of changes. I actually became about 95% plant-based or vegan. I started jogging. Now I'm a big runner. I dropped to 45 pounds, and then I got off of my blood pressure medication, got off my cholesterol medication, and I feel great. And after having that experience, one, I realized I was a terrible example to all my past patients, but the change that I went through and how I felt, I want to share that and help my patients achieve that and my friends achieve that so they can just live a better life. Your life should not be a pile of medications and being limited by a bunch of medical conditions.
Yeah, and it's interesting. I think so often when we get, we build a relationship, with our physician, and they provide that advice. It's easy to forget that. Again, like you mentioned, you went through a lot of those same things, and so I think it really hits home. Speaking of that, the next thing I wanted to talk about is in regards to COVID-19, right? Something that we're all going through right now, and the correlation and how that affects heart health. I'm sure there's a lot of people that have been thinking about this. I know as we were going through this and try to identify these questions. So I'd love to have you touch on that a little bit.
Yeah, so there's a lot of different things that happen with COVID relating to the heart. And there's kind of different stages. If you're about 85% of people that get infected by COVID are pretty much asymptomatic or mild disease. Now, the people that get sick enough to come into the hospital, their dominant feature typically is that they can't breathe, they have a viral pneumonia. Now, of that subgroup that comes to the hospital, probably 2/3 we found on echo and MRI and certain imaging tests have some form of at least short-term cardiac damage that makes their heart not work well. Also, there's probably about 20 or 30% of people that will have what we call kind of a supply-demand mismatch or a stress-induced mild heart attack, what we call a type 2 heart attack, which is further damaging to your heart. Now, the bigger thing is there's something I'm sure most people have heard called the long hauler syndrome, where people have persistent symptoms 3+ months after they recover from COVID. Now, most of that has so far been focused on there's some residual damage in your lungs, but what we're kind of seeing more now is people are getting their lungs feel good, look good, their x-rays are good, but they still have no endurance, incredibly fatigued, they're really out of shape, and that's probably a combination of the cardiovascular, cardiorespiratory system being injured by COVID and taking a long time to recover. And that's and this is why avoiding COVID is so important, because who would want to have a disease that's going to go for 3 to 6 months and limit what you want to do? The symptoms, the quality of life are so important to people. It's not just mortality, not just the short stay in the hospital, but it's all your symptomatology afterward.
Yeah, and I'm glad you mentioned that. I think it feels like there's been 2 stages of this. That is the anybody contracting COVID and then getting through it and hearing that from a family member or a friend. But then, like you mentioned, we're just starting to see some of these lasting effects, from all ages, right? I'm curious. I think originally people thought, primarily just affecting people that had, prior issues or what have you. But like you said, it looks like we're seeing all ages being affected in some cases with some of these lasting effects.
Yeah, I'm glad you brought that up. The other factor that's really important is for people, if you want to avoid getting sick in general, but avoid getting sick or get hospitalized from COVID, the best thing you can do is try to get healthy. Sleep more, exercise, eat well, lose weight. If you look at the risk factors of people that get COVID so bad they're admitted, and people that die, age is probably the worst risk factor, but having heart disease, high blood pressure, obesity, and diabetes are all big risk factors to make you more sick of COVID. And so if you can not have those problems, you can probably avoid the hospitalization, avoid being more sick from it.
So that's a great segue. I think it's time to talk about some tips, right? And/or some things that we can all do to be preventative in nature, to just live a healthy lifestyle along those lines. So I know there's 5 that we were going to address. Love to have you take a little bit of time and go through some of those. And some seem very simple, but always a little bit harder to do on a daily basis. So let's talk about those.
Yeah, sure. Yeah, so basically there's about a million tips I could give people about how to get healthier. And actually most people know all 1 million of them, but it's which ones to do. And people often ask me in the office, what is the one best thing I can do? And what I say is, what are you willing to do? What is easy for you to do? Get the small win first. And some people, for an example, will drink like 14 Mountain Dews in a day. And so you can't tell them to go to 0. So I go, can you cut back 2 Mountain Dews a day? Or like people go, I have 0 exercise program, no walking program. I go, can you just walk inside your house, even when it's cold, a little bit. So there's little small baby steps that people can take. But the biggest thing is, what are you willing to do? What do you want to do? I can tell people, like, you should become vegetarian, but if they love eating meat, that's just not going to be an appropriate first step. So we have a little graphic up here. So I have a little tip sheet that has 10. We kind of narrowed it down to probably the really core 5, probably the biggest bang for your buck and easiest to do. So number 1, a lot of times we say we got to eat more fruits and veggies. And what I kind of tell patients, can you just eat 1 more serving per day? You don't have to eat all 10 recommended servings starting tomorrow, because that's too hard to change your diet. And I like focusing on the positive more than focusing on the negative. If I say don't drink soda, you can't have ice cream, can't have pizza, can't have meat, that's all negative. So you want to have a positive outlook on this. So I just tell them, eat just 1 more fruit serving, 1 more veggie serving. 2 is really great. I think just drink more water. Especially for people that are about to get COVID vaccine shot number 2, being hydrated really helps. A lot of people, including myself, I had about 12 hours of chills after I got it, but it was pretty minor for me, just had a minor headache, and that's because I was really well hydrated, kind of prepared to get that second dose here. And one of the big reasons to go for water per se versus soda pop or even 100% fruit juice is water has 0 calories, fills you up, so you don't feel hungry all the time. And this, a lot of people, you'll see it on health blogs where they go, just keep drinking tons of water, and that kind of keeps you full and helps you not get hungry, which leads to snacking, which leads to calorie, weight gain, etc. The other thing I think is really important is a lot of people, they'll strive for perfection, and that's what number 3 is talking about. Schedule in failure or schedule in your cheat day. So if you see these weightlifters who are just totally ripped and in great shape, a lot of these guys will have 1 day or 1 meal where they kind of really loosen up the rules. And that helps in a number of ways. Probably the big way is it reduces the strain on your willpower. Willpower is great, but at some point you can abuse and overwhelm your willpower, then you want to give up and you just blow the whole program up. Yeah. So if you have a day where you say, I'm going to have my pizza or I'm going to have my ice cream, but the other 6 days I'm going to be real strict and be really healthy, then that kind of gets you through that time.
Yeah, it feels like you really appreciate it that much more, right? When you schedule that cheat day or something that you look forward to, like you mentioned, and can help you to be that much more disciplined. Love it.
Yeah, it's like a reward. The other thing, going back to not being so negative, if you tell someone or tell yourself, I can never have ice cream, I can never have Grater's ice cream again, that's totally depressing. So you can't tell people that. I love Grater's, I have it every now and then. If you have it every day, it's a problem. But on your cheat day, or special occasions, I think it's reasonable to enjoy it and not feel guilty about it. Yeah.
All right, number 4, yeah.
Yeah, number 4. Yeah, basically sleep more. Sleep is totally underestimated how important it really is. What's really interesting is exercise. If you do 20 minutes of something really intense, like heavy weightlifting or interval training, you have a benefit for like 3 days. Exercise is really, really efficient. Sleep is the most inefficient thing we do because you have to get 7 or 9 hours, depending on who you are, to have a benefit. But the incredible thing is, for people that want to learn and get smarter, you have to sleep. From what they've shown in their studies, that's when you consolidate all the information you learned that day, gets organized in your brain at night. So if you have a crummy sleep, it's not going to be put away into deep term storage. You might not recall it or understand it. The other thing is, people like to exercise, and not take a rest or recover. Sleep is when your body rebuilds itself, and then it can handle the next stressor better. So sleep is critical. There's a great story. Gwen Jorgensen, I don't know if anyone remembers her from the Rio Olympics. She's the first American to win the female triathlon at the Olympics. She sleeps for about 40 to 50% of her lifespan. She sleeps like 8 or 9 hours and takes a 1 or 2 hour nap every day when she's in training. Half her time is sleep. So she totally takes recovery seriously, and I think we should as well.
Yeah, it's interesting, and I'm sure you see this on a daily, weekly basis with your patients, is that there's that feeling that for somebody that wants to accomplish a lot, right? If you don't sleep as much, or you feel like you can get more done, but I'm sure you see that once you commit to that extra sleep during the hours when you do need to get things done, I'm sure you see so much higher productivity I mean, I know I felt that. I mean, some of these things that you're talking about personally in the last 3 months, I've committed to, and the sleep thing has been huge. Just the way that I feel, after committing to that. There's that moment in the evening, right, where you say, maybe I could stay up for an extra 2 hours or get that extra hour's sleep. And I have found, to your point, that when I do that, it's just amazing the productivity the next day.
Yeah, it's kind of funny. And when I was writing grants down at the University of Cincinnati, there's something called percent effort. You have to tell the NIH, I'm going to give 30% to this project, 40% to this project, et cetera. And basically, all of us have only about 100% effort to give. You can maybe go 105% for a day or two by cutting out sleep and working harder. But like you said, your efficiency drops off. So it's not a really good trade-off. You should get sleep. You're more functional. And what most people feel is when their energy is high, work hard then. When their energy is low, it's probably time to rest a little bit. You don't have to be cranking through work or exercising hard all the time, because that's going to lead to burnout.
Yeah, no question. I need to do a little bit of work with my daughter, because for whatever reason, every night when we put her to bed, she's 5, she's like, sleep is boring. And we're like, enjoy it now. You need more while you're growing. Yeah. So, all right. The next thing that I wanted to touch on, which I know is actually, there's some questions in the thread about this as well, so I think this is a great topic, is family history. I know a lot of people, I'm sure they ask you all the time, father, grandfather, grandmother, mother, what have you, and having a history of heart disease and how that flows through, the generations and so on and so forth.
Yeah, so there's probably a 3-layered question. In the old days, if your father had heart disease at age 55 or younger, that was a negative for you. If your mother had it 65 years or younger, that was called premature heart disease, and that was a negative for you. There's some more recent studies that says anyone in your immediate family group, especially your mom and dad, if they've had heart disease, cardiovascular disease, that's a negative. Now, we thought that was mostly genetically based, but what we found that about 85 to 90% of your heart cardiovascular risk is not hereditary, it's lifestyle changes. So if you smoke, don't exercise, eat terribly, that leads to diabetes, high cholesterol, high blood pressure, and eventually leads to heart attack and stroke. Your genetic risk is probably 10 or 15%, and that's it. And most people don't believe it or are surprised by that.
Yeah, and again, I think that that's a very encouraging statement, right? Because like you said, for years, I think people felt like, their destiny might have already been laid out when and there was no need or that feeling to be able to make those personal changes. But that's very encourage.
And there's,
sorry. No, go ahead, Doctor.
Yeah,
I'm sorry.
There's actually an article in Time magazine. It came out a couple of years ago, but it has a picture of DNA on the cover. And the big tagline from that article was, genetics loads the gun, but behavior pulls the trigger. Your mom and dad could have given you all the worst genes, but you're going to turn all those bad genes on by your lifestyle choices. Every choice we make has an impact on basically our physical, mental, spiritual well-being.
So we had somebody in the comments. I thought this was pretty cool. It said, "This man helped me get into better shape, and I'm 35 pounds lighter," which is pretty exciting.
That's great.
So we got some fans out there, and reading that made me think a little bit. And you even mentioned this in your video. Taking things a day at a time, right? It seems like such a cliche, but like this getting healthy takes time, right? Just especially if you've had habits over the years that maybe have not been the best. Can you talk about that maybe with just some of the patients that you worked about and really the impact, almost like compound interest, right? You just have to keep doing it every day. And then after month 3, after month 6, I would imagine you really start to see results.
Yeah, I think tiny steps make a big difference. If you read James Clear's book, Atomic Habits, he talks about if you get 1% better at something per day, at the end of 1 year, you're 40% better as a person in whatever trait you're going for. If you get 1% worse each day, you're going to drop 97% at 1 year, your effectiveness. Now, as far as kind of daily little habits, every little thing adds on. There's a kind of a concept called you are the sum of all your training. Not any one exercise or any one meal is going to make you great or blow you up. So that's why, having the cheat days and having the time off is very important. You should work out hard, then take a rest. You can, if you eat an ice cream cone when you shouldn't have, don't guilt yourself and beat yourself up. That's not helping anybody, especially yourself. But if you keep on the program, you fall off, you get back on the program, you can make steady changes. There's a great story, if you Google a guy named Marlon Gibson. It was a CNN story about 4 years ago. He weighed, I think, 405 pounds, and then he dropped 265. And the first change he made was he loved fried chicken. He went from 8 pieces of fried chicken down to 6. And if you hear that, you're like, that's not going to work, that you're going to be a failure. But he went 8, 6, 4, 2, 0. Then he started eating baked chicken, then became vegetarian, then he dropped 265, totally changed his life. So you don't have to become perfect the next day. You have to slowly phase in changes.
Yeah, and I'm curious. I was thinking about this as you were saying that. Obviously, this pandemic has been challenging for everybody. It does seem like, however, that with when there are challenging times, for those that seem to look at it as an opportunity, like you said, taking their health more seriously. I'm curious, Dr. Hahn, have you found, especially in the last 6 to 8 months, as this has lingered on and you've worked with patients, are you seeing that more and more people this has really driven them to take their health more seriously? I mean, are those conversations happening more often than you saw before the pandemic? Is that something that you've been seeing?
Actually, in my experience, most people have gained weight and done worse during the pandemic because they've been home more, snacking, and let's be honest, most of us are totally stressed, either from getting sick, our loved ones sick, or our job, we're being, our hours are shortened, or we've been fired. So that's been a big problem. The other thing that most people have not talked a lot about is kind of the social isolation and the depression and anxiety. That's a huge negative health risk factor for cardiovascular disease and for basically all health. And that's having a huge impact on people. And we have not talked about that enough, I think.
Yeah, I'm glad you brought that up, and I'm sure there's science that's connecting a lot of, or the long-term effect of a lot of those back to heart disease, and even just through the habits. I mean, thinking through those 5 things that you talked about, if you don't continue to do those when you're feeling stressed, or in a lot of those different scenarios, can make things difficult. And what are you advising people to do? I mean, like you said, there's a balance. There's a balance between them feeling like they have to do all those things to be healthy, and truly acknowledging what they're going through right now, right? Which we can't put that under the rug and do everything at once.
Yeah, I think the big thing, one is nothing. Even if you get vaccinated, nothing is 100% in life. So I think if you wear a mask, you can still see your family, have some social distancing. Don't be going to 900 different social pods and mixing around, but you should still be socially connected. People make fun of the Zoom subculture that's developed after this, but I go to Zoom Sabbath school, and I log on early so I can chat with my buddies before the class actually starts. So if you can get socially connected anyway, it's incredible. My parents are very non-tech, and my mom just got FaceTime on her phone 1 week ago. And so now we can FaceTime her. Yeah, it's unbelievable. It took this long. But I haven't seen my parents in over a year because they're in California, and who wants to travel, and everything's shut down in Cali. So we FaceTimed, and she was so happy to see her grandkid. Had not physically seen her grandkid in a year. So that was a big deal for her. But anyway,
I need to get your advice on that, because I still cannot get my mom on Facebook, and if she wasn't, she'd get to watch this right now. So I need someone to get to advice on how to. We just, to your point, I think she recently started using FaceTime as well. It's been some, so it is some sort of social connection, which is great.
Yeah, what worked for my mom is my sister actually physically bought her a phone and gave it to her already set up. That's what it took to make her get on FaceTime. So.
Yeah, I love that. All right, this has been great, Dr. Hahn. I really, really appreciate your time. Again, I think some great tips. Most importantly, that's what we want these chats to be, like, just a conversation with, professionals that are seeing this on a daily basis. Any last thoughts as we wrap today's chat?
Yeah, I think kind of what I tell my patients is, can you pick one thing you're going to work on? And like the guy that drank 14 Mountain Dews, can you reduce that a little bit? Can you walk 2 times a week? Can you eat 1 more fruit or veggie a day? Can you sleep 30 more minutes? Is there one thing you can do to improve your health? And that's an investment in yourself. I can't do it for you. No one can do it for you. But if you take that time, opportunity, and like I said, little steps every day, you're going to make a big change. One other math problem real quickly. The recommended weight loss is 2 pounds per week, and people think that's terrible. if you did that consistently for a year, you drop 104 pounds. So if you keep on your program, and you can fall off and get back on, but if you're making constant little gains overall, when you look back over time, you're gonna see, man, I've had a huge change, a huge impact on my life. And you'll probably see you had an impact on your friends and family as well.
So we actually had a good question that just came in along those lines that I want to make sure we get to. She asked, when you went on your health journey, did you start with something small? And if so, what kicked it off, right? Starting is so hard, she said. Was there one thing that you can remember from your journey, that one thing that kind of kicked it off to keep, to move forward?
It was actually knowledge. My friend gave my wife, and the reason I'm still here and I'm not full of stents or medical procedures and drugs is because my wife is very healthy. She read a book called China Study, which talked about being plant-based or vegan. And she goes, we should incorporate this. And I didn't want to because I liked eating a bunch of dead animals, to be frank. But what we did is she started to cook plant-based, but we still had a lot of meat, cheese, milk in the freezer and refrigerator. We just kind of ate through that and slowly transitioned to going all plant-based. And that kind of helped ease me and the kids into this different lifestyle. And I think that was kind of the big change. The most foundational important thing you can do is have a good diet, because no matter how much you exercise, you can't burn off all those bad calories.
Yeah, I love that. All right, everybody. Well, one of the things we're going to do here on these Kettering Health Chats is always, we've had such great content in this conversation with Dr. Hahn, but also provide resources at the end of each of these. So I want to let everybody know that if you go to ketteringhealth.org/heart, they put together a heart disease risk quiz. So something very valuable for you to take a little bit of time, go through that and take that. And get some results on that. Again, that's ketteringhealth.org/heart. And they have put together a great heart disease risk quiz. So be sure to check that out. We are really excited, again, to get these health chats going and connecting with the great physicians from the Kettering Health Network. So Dr. Hahn, we appreciate your time so much this evening. Thank you for your insight, your story, and we look forward to seeing you sometime in the future.
Yeah, no problem. Thanks a lot, John.
All right, my pleasure.